Hi friends, welcome back to 1000 questions and answers series. First question, type of chest deformity seen in ricket is barrel chest, funnel chest, pigeon chest, none of the above. The answer is pigeon chest. Next question, the highest score in Glasgow coma scale is 15, 13, 14 and 12. And the answer is 15. Which of the following response is not assessed in Glasgow coma scale? Mental status, motor response, eye opening, verbal response. And the answer is mental status. Thousand ml need to be administered in 8 hours and the drop factor is 20 drop per ml. The drop per minute should be 35 drops per minute, 37 drops per minute, 41 drops per minute, 43 drops per minute. The answer is 41 drops per minute. Which breath sound is referred to as classical sign of bronchial asthma? Stridor, stridor, wheezing and expiratory grunting. The answer is wheezing. Strength of Dettol solution used to disinfect a thermometer is 1:20, 1:40, 1:60 and 1:80. The answer is 1:40. Separation of an infected person from the non-infected person to prevent transmission of disease is autoclaving, isolation, quarantine, sterilization. The answer is isolation. Next question, hospital-acquired infection is known as nosocomial infection, opportunistic infection, droplet infection and contamination. The answer is nosocomial infection. Detention of well persons who have come in contact with infectious disease for a period of time equal to the incubation period of the disease. It's known as quarantine, isolation, sterilization, prophylactic. The answer is quarantine. After a cardiac arrest, irreversible brain damage occurs within 1 to 2 minutes, 2 to 3 minutes, 4 to 6 minutes, 8 to 10 minutes. The answer is 4 to 6 minutes. Nurse taking care of a patient with ineffective airway clearance looks for dash as the first sign of hypoxia. Change in level of orientation, change in urinary output, decrease in heart rate, increase in respiration. The answer is change in level of orientation. According to gate control theory of pain, needle prick pain impulses are transmitted through which fibers to the spinal cord? Options are A delta fibers, D fibers, A alpha fibers, A beta fibers. The answer is A delta fibers. The area of the brain responsible for perception of pain is parietal lobe, medulla oblongata, substantia granulus and brainstem. The answer is parietal lobe. The pain which is reduced by one of the various neurosurgical procedures is known as acute pain, phantom limb pain and chronic pain, intractable pain. The answer is intractable pain. Contraction alkalosis is the other name given for respiratory acidosis, metabolic acidosis, metabolic alkalosis, and respiratory alkalosis. It's for metabolic alkalosis. The normal fat content present in the stool is 2 to 7 grams per 24 hours, 9 to 10 grams, 10 to 16 grams, 7 to 10 grams. The answer is 2 to 7 grams. Suboccipitobregmatic diameter is 9.5 cm, 10 cm, 11.5 cm and 14 cm. The answer is 9.5 cm. Suboccipitofrontal diameter is 9.5 cm, 10 cm, 11.5 cm and 14 cm. The answer is 10 cm. A woman having her first pregnancy at 30 years or above called aged mother, old mother, gravid mother, elderly premigravida. The answer is elderly premigravida. Body's immune system is controlled by lymphocytes, neutrophils, monocytes and basophils. And the answer is lymphocytes. Dash is responsible for phagocytosis, plasma cells, monocytes, lymphocytes, all of the above. The answer is monocytes. Color of EDTA tube or bottle: red color, grey, black and lavender. The answer is lavender color. Color of sodium heparin tube: green, black, red, none of this. It's green colored. Which is the position is given for paracentesis? Supine, Trendelenburg, knee chest, none of this. Answer is supine position. After renal biopsy, which position is given? Prone, side lying, supine, Trendelenburg. Prone position. The answer is prone. World No Tobacco Day: May 31st, June 5th, December 7, July 11. The answer is May 31st. What is the effect of cyclosporin in patient undergone renal transplantation? Immunosuppressant, anti-inflammatory, antibacterial, diuretic. The answer is immunosuppressant. Which of the following is an osmotic diuretic? Lasix, aldactone, spironolactone, mannitol. And the answer is mannitol is an osmotic diuretic. Which of the following enzyme released by damaged kidney causing constriction of blood vessels? Aldosterone, renin, epinephrine, non-epinephrine. The answer is renin. Kidney control the concentration of hemoglobin, glucose, amino acid, triglycerides. The answer is hemoglobin. Normal bladder capacity is 2 liters, 1.5 liter, 300 ml, 600 ml. And the answer is 600 ml. Specific gravity of urine is 1.001, 1.008, 2.101, 1.016. The answer is 1.016. Normal glomerular filtration rate is 100 ml per minute, 125 ml per hour, 120 ml per hour, 125 ml per minute. The answer is 125 ml per minute. Microscopic examination of urine reveals elevated levels of RBC. What does it indicate? Urinary tract infection, damage to glomeruli, renal stone formation, abnormal food metabolism. The answer is damage to glomeruli. Early sign of bladder cancer: paleness hematuria, recurrent UTI, and dysuria, urgency of urination. Painless hematuria is the answer. Major complication of hemodialysis: disequilibrium syndrome, hypertension, embolism, ammonium toxicity. And the answer is disequilibrium syndrome. The earliest sign of acute glomerular nephritis: oliguria, hematuria, dysuria, periorbital edema. The answer is periorbital edema. The most common method of urinary diversion is known as bilateral ureterostomy, vesicostomy, cock pouch, Bricker's procedure. The answer is Bricker's procedure. In the oliguric phase of acute renal failure, the nurse should assess the client for pulmonary edema, metabolic alkalosis, hypertension, hypocalcemia. The answer is pulmonary edema. Vaccine that is not contraindicated in pregnancy: rubella vaccine, measles vaccine, varicella vaccine, and rabies vaccine. And the answer is a rabies vaccine. Inhibin A produced by corpus luteum has increased in spinal defects, congenital heart disease, Down syndrome, trophoblastic disease. And the answer is Down syndrome. When auscultating the lungs of patient with thick tenacious mucus in bronchi, the nurse will hear crackles, crepitus, rhonchi and stridor. Answer is rhonchi. An uncoordinated respiratory or breathing pattern is called Biot's respiration, Chinese chalk, Kussmaul's ataxic respiration. The answer is ataxic respiration. Nurse to the family member, it sounds like you are really afraid of what might happen to your husband. This statement reflects empathy, sympathy, trust, respect. The answer is sympathy. JIPMER sign is bluish discoloration of mucosa of vagina, bluish coloration of mucosa of vulva, bluish coloration of mucosa of the uterus, bluish coloration of mucosa of fallopian tube. It's a bluish discoloration of vagina. Marked softening of cervix during pregnancy is termed as JIPMER sign, Godel sign, Braxton-Hicks contraction, none of the above. And the answer is Godel sign. Monomery tubercle is a change associated with an organ during pregnancy. Name that organ: breast, uterus, leg, ovary. Answer is breast. Mask of pregnancy is otherwise known as Haga sign, Godel sign, Chiasma gravidarum, Linea nigra. The answer is Chiasma gravidarum. Which hormone causes cutaneous change in pregnancy? Thyroid stimulating hormone, mid-pituitary hormone, insulin, estrogen. And the answer is mid-pituitary hormone. Last question. Brownish black pigmented area in the midline stretching from the siphisternum to symphysis pubis during pregnancy is striae gravidarum, Linea nigra, Godel sign, and A and B. The answer is Linea nigra. And thank you to everyone.